Hello, this is Lisa, and this is my 5-minute video on deep vein thrombosis. Deep vein thrombosis is a disorder involving the venous system. It's characterized by clot formation within the venous vasculature within the deep veins. DVTs are part of a triad which includes venous stasis, endothelial injury, and hypercoagulable states. Complications include chronic venous insufficiency and pulmonary embolism. A pulmonary embolism can be life-threatening when the thrombi move into the pulmonary vasculature. Approximately 10 to 30% of patients diagnosed with DVT will die within a month.
A 10-year reoccurrence rate is noted in 1/3 of the patients who have been diagnosed with a DVT or pulmonary embolism. Sudden death is the first symptom in about 25% of patients with a PE. Chronic venous insufficiency can be a result of DVT or from an inflammatory condition leading to lower extremity edema, discoloration, and ulcerations.
Risk factors for DVT include immobility or bed rest, hypercoagulable states, advanced age, oral contraceptive use, systemic lupus erythematosus or an antiphospholipid antibody syndrome, obesity, and smoking. Certain questions need to be asked for a DVT workup. Is there a history of medical illness such as PVD, peripheral vascular disease? Patients with this condition may have sluggish blood flow rates in the deep veins. This decreased blood flow can result in blood pooling in the vessels and lead to the formation of clots. Have you recently had surgery or prolonged bed rest? Recent surgery and certain long-term illnesses can lead to pooling of the blood in deep veins also. Prolonged periods of movement decrease circulation to the extremities. This prolonged immobility can lead to blood clots. Have you traveled a long distance recently? Long periods of travel, long rides, sitting with legs bent lead to pooling of the blood and decreased blood flow, which in turn lead to the clot formations. When doing a physical assessment on a patient with a suspected DVT, does the patient have lower leg or calf pain? You need to assess the Hohmann sign, which is assessing the extremity for pain in the calf when the toes are pulled towards their head. About 50% of patients have leg pain. Is the patient's leg or calf warm to the touch, firm with observable redness? Warmth or arrhythmia is often present on the skin over the thrombosis. Does the patient have edema in the extremity? Edema is the most specific symptom for a DVT. Edema with a DVT is unilateral. Also assess for a life-threatening complication of a PE. The patient has shortness of breath, apprehension, sudden chest pain, sweating, and coughing up bloody phlegm. The goal of treatment for DVT is to decrease morbidity, prevent post-thrombotic syndrome, and prevent a pulmonary embolism. Low molecular weight heparins can be given, such as enoxaparin 1 mg per kilogram sub-Q twice a day. Xarelto can also be given at 15 mg BID with food for 3 weeks, followed by 20 mg daily for 6 to 12 months. Below are contraindications for this medication, such as it's not recommended to use during pregnancy or for patients with a creatinine clearance level less than 30. Maintenance therapy includes performing hypercoagulation testing before starting therapy. Treatment with low molecular weight heparin, UFH, and Arixtra is recommended for 5 days and until an INR greater than 2 is achieved for 2 consecutive days. Xarelto 20 mg daily for 6 to 12 months can also be used, and also warfarin therapy should be started on the same day as a low molecular weight heparin, UHF, or Arixtra. Goal for INR is between 2 and 3, and you need to take this medication for 3 to 6 months. Pradaxa is another treatment for DVT. It's a direct thrombin inhibitor, 150 mg BID for 7 to 10 days of low molecular weight heparin and for 6 months afterwards. Low molecular weight heparin and sub-Q heparin can be used if patients are allergic to warfarin. IVC filters should be considered if a patient has a contraindication to anticoagulation.
Some final information about deep vein thrombosis includes patient education. All patients need to be educated about the diagnosis of a DVT and what to do and what not to do. Patients need to walk once treatment is started and symptoms are under control. It can help you feel better faster. Stay active to aid in circulation. Using anticoagulation therapy increases the risk for bleeding, so a few lifestyle modifications may be necessary, such as using a soft bristle toothbrush, using an electric razor to prevent nicks and cuts, avoid activities that have the potential for injury, and to avoid aspirin and NSAID administration. They need to wear an alert tag in the event that they are in need of treatment and unable to inform the medical staff of their condition. They need to avoid long periods of inactivity and crossing your legs. Try to get up and move at least every hour. Patients need to drink plenty of non-caffeinated fluids in order to stay well hydrated. And a last important item of patient education includes wearing support stockings if your healthcare provider advises you to do so. This concludes my video on deep vein thrombosis. Thank you.